Namaste दोस्तों, welcome back, where we are all about understanding health in a simple and fun way. Today, we are going to talk about something crucial, how doctors actually figure out if someone has diabetes. It's like being a detective, but instead of solving a crime, we are solving a medical mystery.
Diabetes is basically a condition where your body has trouble managing blood sugar, also known as blood glucose. It's like your body's sugar handling system is a bit wonky. But how do doctors confirm this? They use specific tests and criteria, which we'll break down for you.
Let's look at this table, our cheat sheet for understanding diabetes diagnosis. It outlines the different tests and what the results mean. We'll also talk about impaired glucose regulation, which is like a warning sign zone, not quite diabetes, but definitely not normal either.
First up, we have FPG, or fasting plasma glucose. This test measures your blood sugar after you've been fasting, usually for at least 8 hours. Think of it as your body's ideal blood sugar level.
If your FPG is less than 100 milligrams per deciliter or 5.6 millimoles per liter, you are in the clear, that's normal. If it's between 100 and 125 milligrams per deciliter or 5.6 to 6.9 millimoles per liter, you are in that impaired glucose regulation zone, also sometimes called prediabetes. It's like a yellow light, time to be cautious. And if it's 126 milligrams per deciliter or 7.0 millimoles per liter or higher, on to separate tests, that's a diabetes diagnosis. It's important to check twice, there could be an error the first time. दो बार चेक करना जरूरी है, एक बार में गलती हो सकती है.
Next, we have the PPG or postprandial glucose, which is also known as OGTT, or oral glucose tolerance test. This is a bit more involved. You fast, then drink a sugary drink, and your blood sugar is checked 2 hours later. It's like a stress test for your sugar handling system.
If your blood sugar is less than 140 milligrams per deciliter or 8 millimoles per liter after 2 hours, that's normal. Between 140 and 199 milligrams per deciliter or 7.8 to 11.0 millimoles per liter is impaired glucose tolerance. And 200 milligrams per deciliter or 11.1 millimoles per liter or higher means you have diabetes. This test really shows how well your body processes sugar after a meal.
This test is really cool because it gives you an average of your blood sugar levels over the past 2 to 3 months. It's like a report card for your sugar control.
If your HbA1c is less than 5.7%, that's normal. Between 5.7% and 6.4% is prediabetes. And 6.5% or higher means diabetes. This test is super useful because it doesn't require fasting and gives a long-term picture.
Finally, we have the random glucose test. This is when your blood sugar is checked at any time of day without fasting. If it's less than 200 milligrams per liter or 11.1 millimoles per liter, that's generally considered normal. But if it's higher than 200 milligrams per deciliter or 11.1 millimoles per liter and you have symptoms of diabetes like increased thirst, frequent urination, or unexplained weight loss, then it can be used to diagnose diabetes. Having symptoms is very important. Symptoms होना बहुत जरूरी है.
These are the main tools doctors use to diagnose diabetes and identify those at risk. Remember, early detection is key. If you are concerned about your risk, talk to your doctor. They are the best people to guide you.
We hope this was helpful. If you have any questions, leave them in the comments below. Stay healthy. Thanks for watching, take care, and have a wonderful day ahead.